morning. I'd like to call this meeting to order. This meeting of the Health and Human Services Finance and Policy Committee of the Senate, and it is Thursday, March 26, 2026. We have several items on the agenda today. First, we will take up Senate File 3295.
Senator Wiklund, we will begin with your bill. Would you like to first adopt the DE amendment? Or perhaps we should walk through it first and then adopt it.
Madam Chair, yes, if we could do a walkthrough of the index and Senate Council, yes, we'll go through that first. Thank you.
Very good. I will turn to Council, please.
Thank you, Madam Chair. So starting with Senate File 3295, as amended by the A1 amendment, Article 1 is titled Health-Related Occupations. In Article 1, found in Sections 1 through 13, Sections 24 to 28, and Section 29, Paragraph B, are from Senate File 4684, authored by Senator Abler, and those sections clarify licensure requirements for chiropractic practice. Again, in Article 1, Sections 14 to 23, and Section 29, Paragraph A, is from Senate File 4523, authored by Senator Boldon. And these sections clarify license and registration, renewal, and application procedures for pharmacy practice, as well as modifying change in ownership and change in business structure requirements for pharmacy licenses and registrations.
And I will take over for Article 2 and Article 3. Article 2 relates to the Department of Health. It's comprised of 3 bills. First, Senate File 4419. That's MDH's policy bill that regulates HMOs and the insurance industry. This bill represents the language as it was amended in our committee, but I will note that it does have a small modification to remove 2 sections that related to interagency data sharing. The second bill that's included in Article 2 is Senate File 3589 or 87 as amended, and that's Senator Pappas's bill to create an exception from the state's hospital construction moratorium. And the final bill in this article is 4091, which is another MDH policy bill, and it reflects the language as amended in this committee. Moving to the specific sections, Section 1, as well as 9 through 10, 29, and 40, those remove obsolete references to various state entities which are no longer active or out of commission. Section 2 clarifies that preventive items are within the definition of comprehensive health maintenance services. That definition, comprehensive health maintenance services, generally describes those minimum services which HMOs are required to cover for enrollees. Section 3 inserts a definition of service area that's currently contained in rule into state statute. Section 4 expands an HMO notification requirement to MDH. Currently, HMOs must notify the commissioner when they terminate a provider within their network. Now they would have to provide that same notification to the commissioner upon termination of all participating entities. Section 5, as well as Section 40 being a repealer, collectively shifts a requirement relating to the allocation of administrative expenses and investment income reporting from an HMO's audited annual financial statements to the HMO's unaudited quarterly statements. Section 6 clarifies a health plan marketing disclosure requirement, specifically a disclosure that the HMO policy does not guarantee access to a particular provider. Section 7 modifies HMO obligations relating to publication of provider networks and related information. Section 8 requires HMOs to reprocess claims to treat newly out-of-network providers as in-network under certain limited circumstances. Section 11 of that article aligns requirements for electronic drug prior auth with the standard required under Medicare Part D for simplification purposes. Specifically, providers and group purchasers must use the NCPD script standard. Section 12 creates a statutory exemption for the medical components of workers' comp, property casualty, and auto insurance from a requirement to transact that business electronically. Sections 13 to 19 is a grouping of sections that collectively modify drug price transparency reporting requirements. The intention is to capture additional entities, notably private label distributors, and additional information to modify timelines and to make technical edits. Sections 20 to 21 of Article 2 clarify that standalone dental plans are subject to Chapter 62K's requirements imposed on individual and small group market plans. These dental plans are already understood to be captured by that Chapter 62K's coverage, but the language around this is currently a bit ambiguous. Sections 22 and 24 make technical changes to remove a reference to a subdivision that no longer exists in state statute. Section 23 clarifies that all covered health services are subject to the time and distance standards in the Code of Federal Regulations. Section 25 clarifies that limited scope pediatric dental plans are subject to Section 62K.10. As noted with dental plans above, this change is intended to be clarifying in nature to make specific ambiguous existing language. Sections 26 to 27 prohibit prior auth and require coverage without cost sharing for items listed on the immunization schedules of certain professional organizations. Then we move on to another bill. That bill is Senate File 4091, which again is a different MDH policy bill. That Section 28 modifies reporting frequency of the Palliative Care Advisory Council. Section 30 is Senator Papps's bill that provides an exception to the hospital construction moratorium. Sections 31 to 32 are MDH policy provisions which modify reporting schedules related to suicide prevention reports. Sections 33 to 34 are from Senate File 4091. Those, again, are MDH policy provisions which provide an exemption to certain contract limits related to issuing certain benefits pursuant to WIC. Section 35 adds that tribal nations may appoint a representative to the State Community Health Services Advisory Committee. Sections 36 to 38 are also MDH policy provisions which clarify licensure provisions for audiologists and speech-language pathologists. And the final section, other than the repealer, which has been noted several times above, is Section 39. That moves a public health filing requirement imposed only on HMOs from a chapter that governs all health plans into a chapter that's specific to HMO oversight. I'll also cover Article 3, which is Human Services Healthcare Policy. Section 1, and I would note that all of these sections come from Senate File 4613. That is the Department of Human Services Healthcare Administration Policy Bill. Section 1 of Article 3 clarifies that good cause for purposes of determining denial or termination of MAEPD for non-payment of premium cannot be granted for an MAEPD premium that has already been paid. For reference, MAEPD stands for Medical Assistance for Employed Persons with Disabilities. Section 2 permits outpatient providers in MA to render services while located outside of a clinic, provided that the provider is under the direction of a licensed physician, as opposed to only being or required to being under the physician's direct supervision. You may recall this provision as being referred to as the four walls rule. Section 3 of Article 3 updates a cross-reference to refer to all enrollees who are exempt from paying premiums for purposes of determining the effective date of Minnesota Care coverage. Section 4 eliminates a requirement to repay past due premiums prior to an individual's re-enrollment in Minnesota Care to align with the 2024 federal regulation on the state's basic health program. This section codifies a policy that DHS has already implemented based on that 2024 federal rule. And then Section 5 extends the due date from December 15, 2025 to November 30, 2026 for a report on the County Correctional Facility long-acting injectable antipsychotic medication pilot program.
Madam Chair, committee members, I will be walking through Articles 4 through 8. Article 4 is behavioral health policy. The three bills that encompass this article are Senate File 4726, which is the DHS Behavioral Health Policy Bill. The sections included from that bill are the ones within this jurisdiction and not within the jurisdiction of the Human Services Committee. This article also includes Senate File 4388 as amended by and authored by Senator Wiklund, and then also Senate File 3734 as amended, authored by Senator Boldon. Section 1 is DHS policy and provides that emergency services providers cannot delay or deny care based on a client's payor source. Sections 2 to 3 are from Senate File 4388, and they establish an early childhood mental health consultation grant program. Sections 4 through 5 modify when a service recipient's rights can be restricted under Chapter 245D. Sections 6 and 15 through 16 make conforming changes to align the review of policies by a children's therapeutic services and supports provider with the Mental Health Uniform Standards Act and removes outdated terminology. Sections 7 and 8 modify mental health professional affiliation and supervision limits and requires a treatment supervisor to sign progress notes. Section 9 excludes weekends and holidays from the requirement to complete a standard diagnostic assessment within 10 days of a client's admission. Section 10 allows persons enrolled in medical assistance to be eligible for room and board services from the Behavioral Health Fund when those services are provided through intense residential treatment services and residential crisis services. Sections 11 and 12 move the development of a healthcare directive by a mobile crisis team from the crisis intervention stage of service to the crisis stabilization stage. Sections 13 and 22 direct the commissioner to rebase rates for certain certified community behavioral health clinics and makes conforming changes. Sections 14 and 18 allow temporary service reductions to be documented in a case file and update a reference. Sections 15 and 17 modify day treatment program requirements. Sections 19 and 20 modify standards for medication management and clinical experience for intensive rehabilitative mental health services. Section 20 contains changes from both Senate File 3734 and Senate File 4388, and they modify who a treatment team must serve and also allows a registered nurse to be a member of the core team. And finally, Section 21 clarifies that all parts of mobile crisis services are exempt from cost-sharing, co-pays, and deductibles. Article 5 is the Department of Human Services Housing and Support Services policy. All of the sections included in this article are from the DHS Housing and Support Services Policy Bill. Sections 1 through 3 make conforming changes and expand the eligibility of the Projects for Assistance in Transition from Homelessness, or PATH, and the Housing with Support for Adults with Serious Mental Illness to persons with substance use disorder. Sections 4, 6, and 9 modify certain economic assistance program requirements for programs administered by DHS. Section 5 requires agencies to report their emergency general assistance policies annually to the Commissioner. Section 7 requires housing support providers to develop, make available, and report on the processes that they use to review and approve housing support agreements. Sections 8 and 9 repeal the Homeless Youth Act and shelter-linked mental health legislative reports. Article 6 is from Senate File 4777, which is the DHS Office of the Inspector General Policy Bill. And sections 1 and 2 make technical and conforming changes to the licensing fee language. Section 3 eliminates the requirement for a standing order for nasal spray opiate antagonists in certain settings. Sections 4 through 14 and Section 21 make technical, conforming, and substantive changes to background studies requirements. Sections 15 and 16 make changes to home and community-based services licensing standards regarding the restriction of a patient's rights and also aligning with the positive supports rule. Sections 17 through 20 make the Department of Health, rather than the Department of Human Services, the lead investigative agency for purposes of reporting maltreatment in psychiatric residential treatment facilities. Article 7 is Children, Youth, and Families, and these are all from Senate File 4520, which is the Department of Children, Youth, and Families Policy Bill. Section 1 clarifies that a nonprofit limited liability company may be licensed to place children for adoption. Section 2 eliminates a requirement that background studies must be conducted at reauthorization for legal non-licensed child care providers. Sections 3 through 5 correct cross-references, and Section 6 is federal law conforming change that allows children in foster care to conduct their monthly caseworker visits via video conference. And finally, Article 8 is the miscellaneous. Sections 1 and 6 are from Senate File 2868, authored by Senator Clark. These remove random drug testing requirements for persons receiving MFIP or SNAP benefits. Sections 2 and 3 are from Senate File 3902, authored by Senator Seeberger. These require ambulance services to report certain pre-hospital care data. And finally, Sections 4 and 5 are from Senate File 3783, authored by Senator Mann, and these modify the definition of drug compounding to exempt the use of a flavoring agent. Thank you, Madam Chair.
Thank you very much. Senator Wiklund.
I don't have any further comments, but if people have any questions about the A1. I don't see any other questions coming forward. I think I'd like to move the A1 amendment, so we had to get that adopted.
Senator Wiklund moves the A1 amendment. Any discussion? Seeing none, all those in favor of the A1 amendment say aye.
Aye.
Aye. All those opposed say nay. Amendment is adopted. Senator Wiklund.
Madam Chair, we have a large technical amendment, and I'm not sure, are we ready to go to that? What's that? Okay. So, yes, I would like to move the 812 amendment, and then if council can walk through that so people know where all of the changes are coming from. These are technical and conforming changes.
Very good. Senator Wiklund moves the A12 amendment. I will ask council to describe the A12 amendment.
Thank you, Madam Chair and members. So this document is marked SCS 3295A12 on lines 1.3 and 1.4. That change is found in Article 1 of the bill on health-related occupations. It adds an effective date to a section relating to chiropractic practice that is meant to take effect on July 1st, 2026. Line 1.5 deletes a section authorizing rulemaking relating to chiropractic practice that the Board of Chiropractic Examiners determined is not needed. Thank you.
Lines 1.6 to 1.7, change the term health carrier to health maintenance organization. This was done as those terms are used in Chapter 62D. The correct terminology in that chapter is health maintenance organization. Lines 1.8 to 1.9 are technical changes. The terms only and also are unnecessary. And then the modification made on line 1.10 is to change the term health plan to health plan companies, as this provision relates to entities, and the correct term for those entities are health plan companies. Thank you.
Madam Chair, members of the committee, line 1.11 is just a clarifying change to the language. Lines 1.12 to 1.13 removes unnecessary language. Lines 1.14 to 1.19 are clarifying changes to the language limiting affiliation across service lines. Lines 1.20 to 1.25 is just deleting that clause within the bill and reinserting the language. I rewrote it to make it more clear, and this was just easier to delete and reinsert rather than having 7 lines of changing. Lines 1.26 to 2.1 are technical changes, striking shalls and inserting musts. Lines 2.2 to 2.3 is DHS, technical assistance, and then a clarifying and technical change from council. 2.4 and 2.5 are just clarifying which change is effective within the effective date, since this section has multiple proposals from various bills. Sections 2.6, lines 2.6 to 2.9 are more technical changes. Lines 2.10 to 2.15 is just technical language cleanup to make the language read more clear. Line 2.16 is striking shall, inserting a must. Line 2.17 is removing obsolete language from the statute. Lines 2.18 to 2.23 are more technical changes. And line 2.24 is technical assistance from the Department of Children, Youth, and Families. This paragraph that these lines are striking is no longer needed with the changes made in paragraphs A and B of that section.
Members, questions about the A12 amendment? Seeing none, anything else, Senator Wiklund, you would have to say about the A12?
No, Madam Chair.
All right. With that, Senator Wiklund moves adoption of the A12 amendment. All those in favor say aye. Aye. All those opposed say nay. Amendment is adopted. Senator Wiklund.
Madam Chair, I understand that there is
Apologies.
Oh, I'm sorry.
Senator Wiklund, we do have one testifier
Oh,
I will
yeah.
ask to
Yeah.
call forward. Mr. Vanizek. Welcome to the committee. Please introduce yourself for the record and present your testimony.
Good morning, Madam Vice Chair and Madam Chair and members of the committee. My name is Rob Vanasek here on behalf of the Minnesota Academy of Audiology today. And apologies for not catching this earlier, but have a late letter submitted to the committee and wanted to provide some comments from the Minnesota Academy of Audiology. And we urge members to consider removing the antiquated practical examination requirement for audiologists who seek licensure by reciprocity in the A1. It's on page 57, Article 2, Section 36. This requirement directly contradicts the purpose of the Audiology and Speech Language Pathology Interstate Compact, which was championed by Vice Chair Boldon and passed into law less than 2 years ago. This practical exam creates a barrier unsupported by evidence and places Minnesota at odds with every neighboring state. We joined this compact in 2024, and it exists to increase access to care for patients, facilitate telehealth, promote cooperation between member states, and simplify the licensure process for qualified practitioners. The patients most harmed by barriers to hearing health access are those in rural areas. And requiring reciprocity applicants, audiologists already credentialed in a member state to travel to St. Paul and pass a in-person practical examination offered only 4 times per year. It's precisely the type of barrier the compact was designed to eliminate, and especially harmful for audiologists seeking to serve Minnesota patients via telehealth who would never physically practice in Minnesota at all. Doctors of audiology have 7 to 8 years additional training and take a national board exam for licensure. Minnesota is an island for even having this hearing instrument dispenser exam required for audiologists. We certainly support it for hearing instrument dispensers who have very limited training and very limited education requirements. I know some of our members are engaged with the Department of Health on concerns with the current exam more broadly, and we look forward to having broader conversation with the department in the future on this exam, but just wanted to raise the issue for the committee and thank the committee for its time.
Thank you for your testimony. All right, Senator Wiklund, I believe you have additional amendments. Would you like to offer those now?
Sure. Madam Chair, I have several, and I was wondering, it's come to my attention, there's a Department of Health oral amendment that they would like to see made, and so I don't know if someone could speak to that, or if Senate Council could speak to it.
Thank you. I'll ask Council to describe that oral amendment.
Thank you, Madam Chair. Senator Wiklund, to clarify, do you want me to speak to the substance of the amendment or state what the amendment would be?
Senator Wiklund.
Madam Chair, if you could state what the amendment would be.
Thank you, Madam Chair. Senator Wiklund. The amendment would read as follows. Senator Wiklund moves to amend the delete everything amendment to Senate File 3295 as follows. Page 44, strike lines 27 and 28. And then a direction to staff to renumber the paragraphs in sequence and correct the internal references.
Members, questions about the oral amendment?
Madam Chair,
Senator Wiklund.
This would complete the change to referencing federal law for network requirements as applies to limited scope pediatric dental plans that was started last year and clarified at line 45.5, which is already in the bill, to my understanding.
Thank you. Questions, members? Seeing none, all those in favor of the oral amendment as described by council say aye. Aye. All those opposed say nay. Amendment is adopted. Senator Wiklund.
Yes, thank you, Madam Chair. I guess I'd like to go to the A7 amendment.
Senator Wiklund moves the A7 amendment. Senator Wiklund.
And members, this is in your packets. This amendment would add the bill we heard that was from the agency bill from MMB. It repeals the two kind of obsolete and requirements that are in statute today because of changes that have been made, and they're no longer relevant. So that's the A7 amendment.
Members, questions about the A7 amendment? Seeing none, all those in favor of the A7 amendment say aye. Aye. All those opposed say nay. Amendment is adopted. Senator Wiklund.
Members, then I would like to move the A3 amendment.
Senator Wiklund moves the A3 amendment, which I believe is in packets. Senator Wiklund.
Madam Chair, this would be amending the language from Senate File 4611, which is the MNsure policy bill as amended that we heard in committee.
Questions on the A3 amendment? Seeing none, all those in favor say aye. Aye. All those opposed say nay. The A3 amendment is adopted. Senator Wiklund.
And then I think the last one I have is the A5 amendment.
Senator Wiklund moves the A5 amendment, which is in packets. Senator Wiklund.
Madam Chair, this would be incorporating language from a bill of mine, or it modifies youth intervention program grant language. And this is something that's been a work in progress over the past year in sort of a technical way to make adjustments. The youth intervention program grant administrator and DCYF have worked together to address issues with the way administrative costs are allocated or laid out in statute. This would clarify language. So that is the A5 amendment.
Any questions on the A5 amendment? Seeing none, all those in favor of the A5 amendment say aye. Aye. All those opposed say nay. The A5 is adopted. Senator Wiklund.
Madam Chair, I think that is all I have. We can go to other amendments.
Other amendments, members. Senator Mann.
Thank you, Madam Chair. I would like to move the A4 amendment.
Senator Mann moves the A4 amendment. Senator Mann.
Madam Chair, the legislature created the Missing and Murdered Indigenous Women and Girls Task Force in 2019, which created a report with recommendations to address this issue, and this is one of their recommendations. It amends the existing multidisciplinary team statute that pertains to cases specifically involving missing and murdered Indigenous relatives.
Senator Wiklund.
Madam Chair, I would see this as a friendly amendment. I think that the bill author has worked with the amendment author and to work out this language, and so I would accept the amendment.
Other questions or discussion on the A4 amendment? Seeing none, all those in favor of the A4 say aye. Aye. All those opposed say nay. The A4 amendment is adopted. Any other amendments or discussion? Oh, I'm sorry, Senator Mann.
Thank you, Madam Chair. I would like to offer the A6.
Senator Mann offers the A6. Senator Mann.
Thank you, Madam Chair. This is the bill we heard about the Minnesota Medication Repository Program. Gives them a little more flexibility how to use their current funds and decreases the amount of paperwork they have to do.
Senator Wiklund to the A6.
Madam Chair, I would see this as a friendly amendment, and I would recommend adopting it. We heard bill language, in the committee about this, and would be good to incorporate this into the omnibus.
Senator Abler.
Just to pile on, I'm just continually impressed with this group and how regular people can make a dent and do truly a good thing. And look where this has evolved. Anyway, so yeah, vote yes.
It is an excellent program. Any other questions or discussion on the A6? Seeing none, all those in favor say aye. Aye. All those opposed say nay. The A6 is adopted. I will offer an amendment. I will offer the A2 amendment. Which should be in members' packets as well. The A2 amendment is an entirely technical amendment. It is cleaning up legislation that we passed last year about provider wellness. It alters language about a provider wellness program that changes eligibility from just targeting physicians to expanding it to target all healthcare providers. The wellness program could include offering services such as peer-to-peer counseling and mental health services. This language extends eligibility and associated confidentiality protections for those who participate in the program to include all healthcare providers. Currently, it is limited to physicians, so we just want to expand that. It's an initiative led by the Minnesota Medical Association, who work collaboratively with other care providers and their organizations in the shared goal to reduce rates of provider burnout and associated implications on the healthcare workforce in the state. So would ask for members' support. Senator Wiklund.
Madam Chair, I think this is an appropriate amendment to add to our omnibus. It's clarifying language, and I think we want to make sure that the program is clear and applies to the people that the program initiators want it to apply to, so.
Other questions or discussion on the A2? Seeing none. All those in favor of the A2 say aye. Aye. All those opposed say nay. The A2 amendment is adopted. I will also offer the A1 amendment. I'm sorry, the A10 amendment. Which members should have as well. This is an amendment related to AI. Essentially, it says that a person practicing medicine or engaged in the practice of medicine cannot be AI. Because it is a person who needs to be licensed, we are saying that needs to be a human. It does allow for the use of AI by a person practicing medicine. It is not affecting that. It is just saying that a person practicing medicine needs to be a person. This may be a bit familiar in the Education Committee. Yesterday, we adopted similar language for a teacher. A human that has a license needs to be a human. So this is just along those same lines, saying that a person practicing medicine needs to actually be a person. Senator Wiklund.
Madam Chair, I guess as I read it over, if I look at it, straightforwardly, I think it does make sense that we want people practicing medicine to be people and not an artificial intelligence model. It isn't something that we have had discussions about in this committee, and I would be interested in other members' comments and feedback on whether this would be sufficient discussion to have today to adopt this amendment. Because I know it's a complex topic, and I just want to make sure that if we are adopting language that we're comfortable that what we're saying is, reflects what we understand about AI and how it would affect people practicing medicine.
Senator Abler.
Well, yeah, so actually I'm worried about it. I'm worried about it in psychology and psychiatry. I guess psychiatry would be a physician. But it's an issue for psychologists as well. And I think it deserves a discussion. I think we want to, I'm afraid of it. I voted for the one in the Education Committee. And I would be surprised if we put it on today, it's actually going to become law in the form. But I think that somebody needs to talk about it. And maybe even after a deadline, we could have a hearing and then just throw it on the floor someplace if we think it's there. But there's a lot of, I'd rather err on the side of not having it. So I don't know how to vote today, but that's just my comment. Thank you.
Senator Utke.
Thank you, Madam Chair. And I agree with some of what I've been hearing here is, and I guess my first question I will ask before I even get into the rest of it, was this even in a bill that was introduced this year? Because we haven't heard anything, I don't believe, anywhere. So if we could start there.
Yes, Senator Utke, it is included in a bill that was introduced. It's in a number of places. There is a bill that has a package that says that any profession that requires a license needs to be a human. And then there's also, as I said, we adopted language in the Education Committee so that it is also in separate places where those individual professions are located as well.
Thank you, Madam Chair, for that. My concern is AI is moving at warp speed everywhere, and I think we need to have more of a discussion on this before we actually insert it in the bill, just because we all need to understand exactly where this is going, and I think I kind of see where it's at, but the fact that we're just getting it as an amendment, I think we need to pull back a little bit, and as been suggested, let's have a further conversation, a hearing, whatever, after deadlines, because we know we have to address AI. That's an important topic, and I agree with that, but I think we need to understand a little bit more before we put in a bill.
Senator Coran.
Thank you, Madam Chair, and kind of echoes some of the same, is that I think I understand the intent, right? It's not going to replace, but it's going to greatly assist anybody in the medical profession. What I also want to know, I think we should have an informational hearing and understand the legal the legal liability perspective with it, because it's embedded whether you know it or not. in so many applications that everybody's using today. So we've rebranded it. Some is real AI, right? It's just an advancement of technology. And so I think we need to spend a little bit of time on it and figure it out. So I don't think it's ready for prime time yet, but we should certainly have, as soon as we get past deadline here, understand all of its impacts and opportunities as well.
Senator Abler.
Well, and I'm worried about this. So, if we're going to vote on this, I would like to include psychologists as well. And then if we're going to, I don't know if it's going to pass or not, but if I could, do you want to take a vote on this? No, today?
Senator Abler, I appreciate the discussion. I will withdraw it, but I do want to continue to have a discussion about this. I think it is an important topic. AI is moving very quickly. It has huge implications. I think now is the right time for us to be acting on it. I'm okay to not have a vote on it in this moment, but do very much want to continue the discussion. So we'll support today.
So,
Senator Abler.
Yeah, and so actually I would have voted yes for my one thing, just to get the discussion out there and create a dialogue as this bill goes to the floor and moves to conference. But I think if there's something we can put together that is sort of thoughtful and, I don't know if who would do a study that we'd rely on, but, this is going to be a big deal. The whole world, in education policy, I was talking to somebody, and this person who used to be, he could hardly collect his thoughts because he spends his time on ChatGPT. And so, that information is not always correct, and we're going to rely on it, and now we're going to diagnose on it potentially. We're going to evaluate people for psychological needs with it. So the time to do it is when nobody really cares yet, when there's not like some big, company in the state that wants to do an AI data center, and now they're going to give each caucus $100,000 to leave them alone. So we want to get ahead of that. So thank you. So appreciate you broaching it.
Senator Port.
Thank you, Madam Chair. I appreciate you bringing this amendment. I think it's an important conversation to have. I think it is worded pretty carefully that it cannot perform the service for which a person is licensed to practice medicine, and so allows for the assistance but not sort of taking over that full work. AI is moving really fast. Technology in general is moving really fast. And what I've learned in my time at the legislature is it's always easier to remove a restriction or a regulation than it is to put it into place after the ball has gotten rolling. And so I think waiting makes me a little nervous. I'm glad that this is in other places and moving in other places. I would vote to support it today as well. Because I do think this is a critical piece, and people need to trust that when they go to the doctor, they are getting the expertise of a doctor. When they are going to a psychologist or a psychiatrist or, whatever medical profession they are seeking, that they're actually getting the expertise of that person and not just AI. So I really appreciate this. I think it's an important conversation.
Senator Kupek.
Sure. Thank you, Madam Chair. And I really hate when my colleagues make very good arguments on both sides. It makes a decision about this very difficult. But I too have a bill about AI and psychology that even after deadline, I think would be really a good one possibly to hear, and then maybe think about that as some sort of amendment going forward on the floor. But definitely a longer discussion about this, I think, would be good. So I'm kind of in the middle on, I love maybe stick it on, I don't know. But also I do think we want a longer discussion on it. So thank you, colleagues, for making my mind cluttered.
Madam Chair.
Senator Wiklund.
Madam Chair, I am aware of Senator Kupek's bill. The advocates for that bill came, and I had a meeting with them and talked about it. And it is really important, and I do understand, Senator Port, your concern about not letting things go on too long and then having to try and adjust later or to hold back things that have already been put in place. I do think that bill, though, when I looked at it, it's much more than a paragraph, and definitely needs more lengthy discussion about the implications of it. And so I I guess I'd still be more comfortable having a discussion separately about that and this. Regarding this paragraph, I guess I would want to get confirmation from medical professionals that this doesn't have some negative impact on, I mean, there's a lot of work that surgeons do with robotic surgery at this point, and I guess I just want to get clarity on how that type of work uses, computer intelligence, and so that we aren't putting something in place that is affecting something that is happening today or being used today in a way that I think people find acceptable.
Madam Chair.
Senator Abler.
It sparked a good discussion. And so this is the kind of conversation we want to have, especially with some of the members of today's audience and people viewing at home. I'm sure the ratings are incredible on this bill. But just process-wise, if there's this bill goes to the floor, and then, Madam Chair, do you think that this bill, the way it is, would be germane to adding in that topic? And if not, having your little amendment that's kind of hastily written would at least give a place to be replaced. And the agreement could be that that's not going to be the final language, but it would be at least a way that nobody could challenge germaneness. Madam Chair.
Senator Wiklund.
Do you think that's an issue?
Madam Chair, I guess I would see if council could comment on that. Is section 147.081, is that something that's referred to in any other part of the bill or something similar to it that we would be able to add something later on the floor?
Senate Council, whoever would like to speak to that.
Thank you, Madam Chair. The amendment does cover Chapter 147, which covers the Board of Medical Practice in this committee's jurisdiction. So it's in an article related to health-related occupations.
So it probably would be.
So I believe there's an argument that it would be appropriate.
Senator Abler.
Well, I'd be happy to vote. I'm just one vote. I don't know people's comfort level, but if you stick it on, at least now you have something to replace it with. And the agreement would be that's not going to be the law, but it's a place to create a discussion both on the floor at future hearings. So if we come up with something, that would be a very relevant hearing then, even though it's after a deadline. So if you want to reoffer it, I'm going to vote for it. So, thanks.
Senator Wiklund, thoughts about that strategy?
Madam Chair, I would also state that it would be germane to the other bill the scope and licensing bill that we're going to discuss today. So, it would be germane to that bill as well.
Very good. I will withdraw it for today. I very much appreciate the conversation. I would like to continue to work with you and happy to continue working on the language. I do think this is a space where we should be acting, but fully understand that we want to get it right. The intention is not to disallow AI to be used, in conjunction with medicine. Certainly it is, and there are good uses for that. The intention is to be sure that AI is not practicing medicine as a individual. And so I'm happy to keep working on that language, Madam Chair. And thank you, members, for the discussion. So I will withdraw the A10 amendment. Any other amendments, members? Senator Udke.
Thank you, Madam Chair. I would like to offer the A11 amendment.
Senator Udke offers the A11 amendment. Senator Udke.
Thank you, Madam Chair. And Senator Wiklund, this is an amendment we just saw, I believe it was last week when we met at one of our evening meetings, and this has to do with CARMA, the County Administered Rural Medical Assistance Program. And this amendment, again, just adds the technical language that aligns, or for DHS to align to the court ruling that came out this past summer. So it's just a technical adjustment to make sure that we're doing things the right way. And I'm hoping that we can, that whole bill, we didn't vote on anything because it was, I don't believe it had a bill number yet that night, and just wondered if we could get this added today.
Senator Wiklund.
Madam Chair, Senator Udke, if this is the same as what was brought forward that evening, then I would, accepted. I think we had a discussion, and I don't have concerns about adding it right now.
Madam
Senator
Chair,
Edke.
Senator Wiklund, yes, it is word for word the amendment we had last week.
All right, other questions or discussions on the A11 amendment? Seeing none, all those in favor of the A11 say aye. Aye. All those opposed say nay. The A11 is adopted. Senator Edke.
Thank you, Madam Chair. And Madam Chair and Senator Wiklund, I would like to offer an oral amendment. And I'm just following up on the testimony we had earlier today, which takes us to page 57 of the A1 amendment. And I would like to strike lines 31 and 32, which was the new language for licensure for the audiologists.
Senator Wiklund.
Madam Chair, Senator Edke, I appreciate your bringing this idea forward based on the testimony. I do wish to hold off on doing that at that time because I did not receive the email about this concern until this morning. And so I would really like to be able to consult with the Department of Health because it was their policy bill that they brought forward with this language. So I would really appreciate being able to have a discussion with them before we decide on, whether that just striking that language is acceptable and to them and to the audiologists.
Senator Edke.
Thank you, Madam Chair. And that sounds good. And I guess my question would be then is, after you follow up and if it all checks out, could we offer a formal paper amendment on the floor when this is brought there if we all align?
Senator Wiklund.
That would be appropriate, yeah.
Okay.
And either, if we have other technical amendments or it could be separate, so.
Senator Edke.
Thank you, Madam Chair. Thank you. That's all I have.
Madam Chair.
Senator Abler.
I don't know if there's an amendment or just a discussion, but I would be curious, did we hear this bill and was there testimony that was provided about these various elements of that particular bill?
Madam Chair.
Senator Wiklund.
Are you speaking about the audiology
Well, that
provision?
in particular, yeah, was that
Senator Abler.
before us?
Yes, we did
Senator
hear
Wiklund.
that bill. Madam Chair, we heard that bill. Let's see if I could find it in the index. That was in Senate File 4091. And I believe did we hear that, Madam Chair, the evening hearing? That was, a week or so ago.
All right, thanks. So, Madam Chair.
Senator Abler.
So I just I appreciate that. So I didn't know the answer. Supposed to not ask questions they don't know the answer to, but I appreciate that answer even more than, very much I appreciate the answer. I get concerned sometimes with the departments, and I'm not going to take time now, but I would be interested to have the department tell me how they interacted with the audiologists and came up with this, if they were aware or not, and what the discussions was, because I've been noticing a trend, at least in the other department that we serve here, that there's been precious little discussion with some of the things that come out of that department, and some of those programs aren't working as well because of that lack of discussion. And so, again, not knowing the answer to that question, I'm not going to burden anybody with more time, but that's my question. It seems like the testimony is pretty strong for eliminating that, and so I'm happy to, trust your meetings and hope at the end that you can agree with them. So thank you. I appreciate it.
Senator Edke.
Thank you, Madam Chair. And I just need to finish the business. I offered an oral amendment. I have to withdraw it. So I will withdraw so that we are all good. So thank you.
Senator Edke withdraws his oral amendment. Any other amendments, members? There is an A8 posted. Okay. Okay. Senator Wiklund, any closing comments?
No, Madam Chair. I think that the bill, we tried to bring together policy language from bills that we heard that were either, from the agencies or from advocates. I worked with and Senator Boldon worked with mental health advocates for some of the a couple of policy bills that we brought forward. And so I think this is a way to bring some policy changes forward that are not, that don't have a cost and can improve access to mental health care, for example, and also bring a way for the agencies to get clarity on different areas that they wanted to bring forward. So I appreciate your attention and going through it today, and I don't have any other comments.
Madam Chair.
Senator Abler.
I am stepping on the author's final speech. I just got a note from the Department of Health. They're going to re-engage in conversation. So I very much appreciate that. Thank you, Madam Chair.
All right, with that, Senate File 30, Senator Wiklund's motion is for Senate File 3295 be recommended to pass. Sorry, let me restate. Senate File 3295 as amended be recommended to pass. All those in favor say aye. Aye. All those opposed say nay. The bill is on its way to the floor. Thank you, everyone. Next, we will move to Senate File 3298. Senator Wiklund.
Thank you, Madam Chair. Senate File 3298 is the Health and Human Services Omnibus Scope and Licensing Bill. And we had an overview from Ms. Heichel yesterday. And so you are aware of what is in the bill. We do have let's see, we need to adopt the A1 amendment. Do members have any questions about the A1 amendment? And then I have a purely technical amendment that council can walk through after we do that.
Okay, let's take the A1 amendment first. Members, any questions about the A1? Seeing none, all those in favor of the A1 say aye.
Aye.
All those opposed say nay. The amendment is adopted. Senator Wiklund.
Madam Chair, I'd like to offer the A5 amendment.
Senator Wiklund offers the A5 amendment. Senator Wiklund.
I would ask council if they could walk through the A5 amendment so people know what the technical changes are.
Senate Council for the A5 walkthrough.
Thank you, Madam Chair.
Senator Wiklund.
Maybe, I just recalled that we had a kind of last minute update, and I should address before we walk through this. Can I make an oral amendment to the A5 before we go forward?
Yeah, do you want to describe your oral amendment?
We have received information that the parties aren't all in alignment about with respect to the Board of Social Work titles article. We had included some shifting in this A5 amendment. We included moving out the date for implementation, and now we're understanding that that isn't something that's completely discussed and decided on. And so I'd like to strike, I believe I would like to strike lines 1.21 and 1.22. Is that correct, Ms. Heichel?
Ms. Heichel, please describe the oral amendment for us.
Thank you, Madam Chair. The oral amendment would read as Senator Wiklund moves to amend the delete everything amendment to Senate file number 3298 as follows. Strike lines page 1, line 21, and page 1, line 22.
Members, any questions about the oral amendment? Senator.
Thank you. Thank you, Madam Chair. I received some feedback about this morning as well, so I appreciate you taking it out at this time.
All right. All of those in favor of Senator Wiklund's oral amendment, say aye. Aye. All those opposed say nay. The oral amendment is adopted. Then to the underlying amendment, Ms. Heichel.
Thank you, Madam Chair. So reviewing the A5 amendment, line 1.3 is related to the massage therapy and Asian bodywork therapy article, which is Article 3, that deletes a section related to appropriations not needed in this policy bill. Lines 1.4 through 1.20 all relate to Article 5, music therapy licensure. And these amendments are based on technical assistance from the Department of Health addressing their capacity to monitor a couple of things. First, continuing education requirements. It deletes some specific requirements that were listed in the bill and instead makes a reference to national continuing education standards. It also amends renewal licensing language to ensure that MDH has the capacity to effectively issue and renew licenses. Thank you.
Thank you. Members, questions or discussion on the A5 amendment? Seeing none, all those in favor say aye. Aye. All those opposed say nay. The A5 is adopted. Senator Wiklund.
Madam Chair, I guess then we can move to other amendments. First, I would like to offer the A3 amendment.
Senator Wiklund moves the A3 amendment. Senator Wiklund.
Members, this A3 amendment is the language that we heard the other evening, Tuesday evening, and would incorporate Senator Hoffman's bill that would allow pharmacists to initiate, prescribe, dispense, administer drugs for the treatment of opioid use disorder. And so it's just taking that language and putting it into this scope and licensing bill.
Senator Port.
Thank you, Madam Chair, or perhaps Senate Council. Can you just explain what the lines 1.16 to 1.19, how that change works, striking those and then adding in the other cross-reference?
Ms. Heichel?
Senator Port, can you repeat the question, please?
Yeah.
Senator Port.
Thank you, Madam Chair. 1.16 to 1.18, it strikes a lot of the individual of the A3. Strikes the individual things that they used to be able to do, and then are those all included in that new subdivision that's referenced there?
Ms. Heichel.
Thank you, Madam Chair. Instead of permitting, or instead of addressing the specific medications, it references a subdivision that is titled the practice of pharmacy, and it lists, I think there are, I don't have the statute in front of me, but there's several paragraphs about what is included in the practice of pharmacy, including the new, what is added later in the bill as the ability to treat substance use disorder. So
Senator.
it's referencing what is the practice of pharmacy. Actually, now that I look at it, it is section 2 of the bill. That's the practice of pharmacy, so it references, these are, if you, I'm not sure if you have it in front of you, but that it references that this is included in the practice of pharmacy.
Senator Port.
Thank you, Madam Chair. I just wanted to make sure that none of the things that we're removing have an unintended consequence later on.
Senator Abler.
Well, thanks. I think this is a great amendment. I think the pharmacists have proven over and over again that they're very capable to do this, and actually, frankly, many more things. There's, and especially in places where there's underserved areas, I think they're capable of even doing more. So, thank you.
Any other questions or discussion, members? All right. Seeing none, all those in favor of the A3 amendment say aye. Aye. All those opposed say nay. The A3 is adopted. Senator Wiklund?
Madam Chair, I don't have other amendments.
Okay. Do other members have amendments they would like to offer? Oh, Senator Coran. I thought you were saying you were good.
Thank you, Madam Chair. And I'd like to move the A2 amendment.
Senator Coran moves the A2 amendment. Senator Coran.
And I think it's in your packet. This has to the Board of Marriage and Family Therapy, and we heard the bill and we heard the testifiers really around the marriage and family therapists, and I'll just cover briefly the primary or a couple of the highlights. And really the proposal just changes the marriage and family therapist licensure reciprocity law by moving the requirements from administrative rule into statute, simplifying the process for qualified out-of-state therapists to become licensed in Minnesota. It eliminates a 5-year waiting period. It doesn't reduce the requirements that Minnesota mandate to ensure that we have high-quality marriage therapists, but to help fill a void, which is part of the challenge in all of our scope of practice and our changes here. So I would love your consideration from the committee and would hope you'd vote yes and accept it. Thank you, Madam Chair.
Senator Wiklund.
Madam Chair, Senator Cran, thank you for bringing the amendment forward. When we heard the bill, it really did seem like a good example of practical work we can do, and I'm happy to incorporate it into this bill.
Other discussion?
Thank you, Madam Chair, and thank you, Senator Wiklund.
All right, all will vote then on the A2. All those in favor say aye. Aye. All those opposed say nay. The A2 is adopted. I will offer the A4 amendment, which is a bill that we heard in this committee related to the Board of Dentistry. As a reminder, I will just recap that this does a few things. It makes some technical and conforming changes throughout. I won't go through all of those. It replaces dental school or schools with dental and allied dental education programs to align with coded terminology. That's a technical update. It updates the specialty dentist section to reflect the correct name. It removes records and interview language in the specialty dentist section to align with current licensure by credential processes. A number of other technical updates, revises some CPR language. It aligns the emeritus license section with other license expirations. So largely technical updates and conforming changes, and we did hear this in committee. Senator Wiklund.
Thank you, Madam Chair, for bringing this forward. I don't know if members have questions. We did request a questionnaire be filled out, and I believe members have copies of that, or no, not.
There are copies available if members would like to see them.
I'm not sure. I have the amendment. Is it passed out? Or was it passed out? If I don't, maybe I just didn't pick up everything.
Did everybody get it?
Yeah.
We will bring you one.
Okay, thanks.
I will just say for everyone, it is the exact language of the bill that was heard in committee.
I don't have concerns. I mean, I think that we had a good discussion or hearing on this bill, and if members have any questions or concerns, we wanted to make sure we got the questionnaire filled out because that's been part of our standard process for these scope and licensing bills, and that was done and posted. There hasn't been as much time for that to be out there, but the bill itself, we did have a hearing on it, so I'm comfortable adding it to this bill.
Questions or discussion, members? Seeing none, all those in favor of the A4 say aye.
Aye.
All those opposed say nay. The A4 is adopted. Lastly, then, I will offer the A6 amendment, which should be in members' packets. This amendment would repeal the transition to practice requirement for nurse practitioners and certified nurse specialists that we heard testimony about yesterday. It's the language from Senator Kupek's Senate File 1794, on which I am a co-author along with several other members of the committee of both parties. APRNs in Minnesota have full practice authority, but NPs and CNSs, after they become a registered nurse, after they go back to school to complete their advanced degree and clinicals and certification, must then work for 2,080 hours in a setting that also employs a doctor. This requirement was put into statute as a compromise in order to allow APRNs full practice authority back in 2014. Since gaining full practice authority, APRNs have been able to serve patients better in all kinds of settings, in NPs and CNSs, lead clinics, and private practices all over the state, especially in primary care and mental health care. And certainly we all know of the access issues that we have across the state. But as we heard yesterday, this requirement prevents those clinics from hiring new graduates, even those graduates trained in the clinic and leads many that want to work in Greater Minnesota or other APRN-led clinics to end up in large health systems instead, or leave for states without these requirements. That would be a small price to pay if these advanced practice nurses needed this extra year or more post-certification work alongside a physician in order to provide appropriate and safe care, but this just isn't the case. APRN's education prepares them for practice. This bill is on the general register in the other body. It has broad bipartisan support in both bodies, and while we did not hear this yet in committee, I do want to honor the story we heard yesterday and the merits of this issue by offering this amendment today. I know that the APRN group is willing to continue conversation and work towards compromise, and appreciate the discussions that have been ongoing. Senator Wiklund.
Madam Chair, yes, this is a bill that, I've learned about over time and have met with stakeholders on both sides of it. I was not comfortable bringing it forward and hearing it based on information that I learned that just gave me pause about whether this was an appropriate action to take to remove this requirement. And so I am open to continuing discussion with both the APRN coalition and the physicians to understand better what some of the concerns are. Part of my concern is that while I understand that maybe the value of the requirement seems to be in question, I'm not sure that removing the requirement is the right step to take. And so that's my position at this point. And I understand that it has been heard and moved in the other body. So,
Senator Port.
Thank you, Madam Chair. Thank you, Senator Wiklund, for your willingness to keep talking about this. I do think, in a moment when we need more qualified healthcare professionals in Greater Minnesota, particularly, and we are desperate to not lose new graduates as they come out of school. I think it would be really helpful if we could find wherever that compromise space is there. I agree, I don't know if completely removing the requirement is the right path or lowering the requirement, but I do think that it's an issue that would be well served by some conversation and a compromise, and I hope we can keep talking about this.
Senator Kupek.
Thank you, Madam Chair. Obviously, this is my bill, so where I come down on this. And it does, it's not only, it plays very different in rural Minnesota, where, you have to travel distances to find a doctor to train with, and then it plays even weirder when you get on the border of North Dakota. One of my constituents lives in Moorhead, practices in Fargo, takes interns or, people coming in for their residency. Those ones cannot see any patient from Minnesota. They can only see patients from North Dakota because North Dakota law is different, but we have this law. So and Senator Wiklund, I always appreciate the fact that you are kind of looking for the proverbial peace in the valley and to let those groups kind of work it out together, because they probably know better than most of us up here in terms of working that out together. But I hope that particularly the doctors on this side can sense where the momentum is going on this bill, because it is growing. I will say I think the APRNs passed out a sheet of paper on the floor the other day, and I don't know how many senators came up to me afterwards and said, "Oh, I see you have that bill. I'm really supportive of that bill." People who were not on this committee, people I did not know had strong feelings and passions about that bill. So there is momentum building. So certainly, I hope that you continue to talk and come together and find some way to do that, even if we don't, add this on here today, but we need to do that.
Thank you. I appreciate the conversation, Senator Wiklund. I appreciate your thoughtfulness around this issue. I will withdraw the A6 amendment for today, but do hope that the conversation can continue. It is an important issue. We do have access issues across the state. We have a group of folks who are well-trained, capable experts and ready to deliver that care. And so finding a way to make that happen is really important. So my apologies. Senator Mann.
Thank you, Madam Chair. Access to healthcare is absolutely an issue. But I think we have to start getting away from the idea that less education, less supervision, less time spent with patients is the answer to access. This is a patient safety issue. We are talking about a profession where if you make one wrong choice, you can kill somebody. So education in this particular profession, in all healthcare professions, is incredibly important for those reasons. If we're going to keep talking about just removing education and supervision, why don't we talk about getting rid of residency requirements for doctors, right? It's because we don't want to kill people, and that education is incredibly important. So again, I do think that there's room for compromise here. I don't think across any profession, removing education and supervision at a time where it's critically necessary to learn is the answer. Thank you, Madam Chair.
So again, I hope the conversation can continue. I know the APRN folks are willing to do that, and hope that there is a room to find a compromise here and a way to make this work for all. And so I will withdraw the A6 amendment. Any other discussion to the bill? Senator Wiklund.
Well, thank you, Madam Chair. I appreciate the discussion today. I wanted to bring forward a bill that included items that I thought had, broader support or had been thoroughly discussed. I think we've come up with something that is not as comprehensive or large as what we did 2 years ago. Last year, we took care of a few other items that had been in the works, and this year, I think we're incorporating items that we've had discussion in committee. I appreciate the discussion we had during the hearings to understand different points of view, and I appreciate that this work has been, a bipartisan effort to try and take into account what changes might be necessary in various health professional scopes and licensing bills or areas. So thank you for the time today, and I hope we can pass this. This will go to the Finance Committee because the different boards have like a financial impact, not to the general fund, but it does have financial impact, so it needs to go to Finance.
All right, so Senator Wiklund moves that Senate File 3298 as amended be recommended to pass and referred to the Finance Committee. All those in favor say aye. Aye. All those opposed say nay. Motion passes and the bill is on its way. All right, we will move to Senate File 4775. Senator Wiklund.
Thank you, Madam Chair. Senate File 4775 is the Human Services Forecast Adjustment Bill. This is something that we do, I guess, seems like most years, or budget year or non-budget years, maybe is a better way to put it. And so I don't really have any other comments about this. This bill will be referred to the Finance Committee from here.
Madam Chair.
Senator Abler.
Well, thanks, and I understand what the bill is in its face. And sometimes we use these for vehicles. So just to what this bill might become, Senator Wiklund, do you have any idea what we're going to do? The House is refusing any omnibuses, which I think is untenable. I mean, I don't like omnibuses, but like finance ones and policy ones, I don't know if those are at risk. Do you know how we're going to do our budget? Do you feel like commenting that in public, or is that a fair question?
Senator Wiklund.
Madam Chair, Senator Abler, I think it's still a work in progress, and, we are continuing to have discussions about how to move things forward. I think there are a lot of really important items that we are working on this year that I would like to see move forward and get passed, and it's not as straightforward as other years working with the House. So I think we are continuing to look at what options we have and how to bring things together in a way that, that we can successfully have a discussion on the floor and get them passed with the other body.
Senator Abler.
Well, I think your comment about the House is probably the understatement of the year. Appreciate that. But I hope whatever target we get is not at the expense of nursing homes and people with disabilities. I think the governor made some really horrible choices, and education, I might add. Special ed, which I just do not comprehend how that can even be coming from a governor from, that's the stereotype of a different party. But so it's just really odd times. And at the end, I suppose there'll be some effort to prioritize some things. But anyway, thank you for that.
Other questions or discussion, members? Seeing none, Senator Wiklund moves that Senate File 4775 be recommended to pass and referred to the Finance Committee. All those in favor say aye. Aye. All those opposed say nay. Motion passes, and the bill is moving to Finance. Next, we will move to Senate File 4776. Senator Wiklund.
Madam Chair, 4776 is another forecast bill, adjustments bill, and this one relates, actually, I guess both of them, I should have stated in the other one, relate to the Department of Children, Youth, and Families and the Department of Human Services, but is a similar, in the similar vein, so.
Any questions or discussion, members? All right, seeing none, Senator Wiklund moves that Senate File 4776 be recommended to pass and referred to the Finance Committee. All those in favor say aye. Aye. All those opposed say nay. Motion passes, and the bill is on its way. I'll hand the gavel back to Chair Wiklund.
Senator Boldon, you have Senate File 4520, and this bill, you do have, there is an author's amendment, the A1. Would you like to adopt that?
Yes, please, Madam Chair.
Members, Senator Boldon moves the A1 amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The amendment is adopted. Senator Boldon.
Thank you, Madam Chair. Similar, this bill is around, as stated, nonprofit limited liability companies, childcare background study, foster care placement, child maltreatment related to the Department of Children, Youth, and Families.
I'm sorry, Senator Boldon. Any members, any questions about the bill? Seeing no questions, this is a bill that we will send to the floor. There is a House companion as well. So if there are no other questions or comments, any final comments? Senator Boldon? No. All right. Senator Boldon moves that Senate File 4520 as amended be recommended to pass. All those in favor, please signify by saying aye. Aye. Any opposed? The motion does prevail, and Senate File 4520 as amended is passed. Thank you. And seeing no other business before us, we are adjourned.